Hi, I'm Dr. Katie Berry. I'm one of the surgeons here at Veterinary Healthcare Associates, and today I wanted to talk a little bit about a common injury that we see in dogs that's called a cranial cruciate ligament injury. The cranial cruciate ligaments live inside the knee, and they're kind of like the ACL ligaments in humans. However, dogs aren't little humans, and their knees are made up a little bit differently. So they actually need these ligaments to prevent the two bones in the knee from moving back and forth. And when one is torn, those bones can move and cause pain and inflammation. So some signs that we can see if your dog has a cruciate injury, limping is the number one thing that we usually have dogs come in for that for. There can be some swelling around the knee, holding that leg up, not being as active as they want to be. Sometimes you'll even hear a yelp or a scream when they're outside playing. And those can all be signs that they've damaged that cranial cruciate ligament or the ACL ligament. So while these ligaments are similar to the ones that we have in our knee, usually when we injure our own ACL, we're doing something active. We step in a hole or turn the wrong way. And a lot of times it looks like that in dogs, but we think that there's something in the knee that just doesn't like those ligaments being there. And it's actually a degenerative process that causes those ligaments to weaken over time, and then they tear when they're doing something active. This is important to note because there's not really anything we can do to help prevent this in dogs that are going to be predisposed to having this, other than keeping them as lean as possible. That kind of helps prevent arthritis and orthopedic injuries in general. So dogs that have a tear to their cranial cruciate ligament, it's usually going to happen regardless. And that's also important to note because a lot of times it will happen in both knees at some point in their life. So there's a couple different kind of levels of injury that they can have to this ligament, and that starts with a partial tear. And a lot of times that's very subtle lameness that you can see where they're limping off and on, or sometimes don't want to be as active as they used to be. And that's where the knee is still pretty stable and doesn't have a lot of movement in there. A lot of times we can treat these dogs conservatively with some rehab options, with rest and anti-inflammatories, and again, getting some weight off of them to kind of help relieve some of that pressure on their joint. When they progress to a full tear, that's usually when we think about surgical options. Some dogs can still have response to conservative therapy like medications and rest and those kind of things, but a lot of times that knee is very unstable, or kind of those bones move too much and the body doesn't like that. So that's when we think about surgical options. Another factor that we have to think about with this disease is injury to the meniscus. So the meniscus are two cartilage pads that live in the joint, and when those bones move, they can actually crush the meniscus. In humans, we'd go in and we would repair the meniscus. In dogs, it's not been very successful. And so a lot of times though, those dogs are very, very painful and won't get much better without surgery. And so we recommend going in and removing that damaged portion so that they feel a lot better. And that's something that we do before all of our procedures when it comes to surgical correction of cranial cruciate ligament disease. So you've probably seen a lot of different options out there for treatment of cranial cruciate ligament disease, surgical treatment especially. There's kind of the top three that we see that are recommended the most. The gold standard is the TPLO, or the Tibial Plateau Leveling Osteotomy. Basically a lot of words to say that we make a cut in the bone and kind of change the angles of the joint so that they don't need that ligament anymore. In humans, they will go in and replace that ligament, and we find that didn't work in dogs just because there's something in the environment that just doesn't like that ligament there. And so somebody did the math and figured out the angles that they need to be able to walk without a ligament, and that's what the TPLO does. Another procedure that you might see out there is one called a tibial tuberosity advancement, or a TTA. Kind of similar to the TPLO, we change the angles of the joint so they don't need that ligament anymore. We just make our cut in a different place. Another procedure that is one that we used for many years before some of these bone cutting procedures were out there was one called the lateral suture stabilization. And that's basically where we take a fishing wire and go on the outside of the joint and kind of mimic what the ligament is doing inside the joint. That's a procedure that works really well for smaller breed dogs, but we've actually found in larger breed dogs that it doesn't do what we really need it to do. And also it doesn't decrease kind of the onset of arthritis in the joint. And so not an ideal procedure for most big dogs. So with the TPLO procedure, we actually go in and make a controlled fracture on the bone. We make a rounded cut on the shin bone, rotate that by a certain amount of degrees, and so that the top of the bone is flat when they walk on it. And then we put a bone plate and screws in place to hold that until the bone heals. Once the bone heals, that's a permanent fix. They can't re-injure that ligament, and they can go back on to living their normal, active, happy lives. Some of the complications that we can see from this procedure are breaking of the bone in places that we don't mean for it to break. Sometimes if the dogs are too active afterwards, they can actually break the the screw and the bone plate. And then also another thing that we worry about is infection. And if infection sets in, we do have to go back in and take that bone plate and screws out. Otherwise, the dog will keep that the rest of their lives. After this procedure, since we're basically fracturing the bone, it's very important for your pet to be very confined while that bone is healing. In most animals, that takes 8 to 12 weeks, and then they can go back to unrestricted activity. However, in that time when they're healing, especially the first 4 to 8 weeks, they need to be kept very confined, leash walks only. And here at Veterinary Healthcare Associates, we actually send you home with a rehab plan to help build up that muscle, help with recovery, and help engage them during that recovery process. And here at Veterinary Healthcare Associates, we have the technology available to do in-hospital rehabilitation to help with their recovery as well. To name a few, we have underwater treadmill, shockwave therapy, laser therapy, and we also do some ground exercises to help with coordination and muscle mass. So if you feel that your pet has any of the symptoms that we've talked about today, or if your regular veterinarian has diagnosed a potential cruciate injury, go ahead and book a consult with us today.